Afternoon, everyone, or good morning, depending on where you are joining us from. I'm Dr. Michael Warren. I'm a pediatrician and the Associate Administrator of the Maternal and Child Health Bureau here at HRSA. And I want to welcome everyone to today's webinar announcing the winners of our Promoting Pediatric Primary Prevention, or P4 Challenge. I'm also very pleased to share that HRSA's brand new administrator, Carole Johnson, is joining us to get us started. Carole's extensive leadership in public health policy and on national responses to public health emergencies like Zika and Ebola positions her well to partner with us on the P4 Challenge. In fact, Carole's roots with HRSA run deep, as she previously managed healthcare workforce policy issues for our agency. So in many ways, this is like a homecoming for her. Most recently, Carole served on the White House COVID-19 response team. Before that, she was commissioner of the New Jersey Department of Human Services, where she led the state's largest agency that provided healthcare and social services to 1 in 5 New Jerseyans. She also served for more than 5 years as the Domestic Policy Council Public Health Lead in the Obama White House. In addition, she served in multiple leadership positions on Capitol Hill, including as health staff for members of the U.S. Senate Finance Committee and the U.S. House of Representatives Ways and Means Committee. Carole, we are so grateful for your leadership, and I'm pleased to turn our webinar over to you for welcoming remarks.
Oh, thank you, Michael. Thank you, Dr. Warren, and your team for this terrific initiative, and for all of those on the line who have done just amazing work to help respond to what we know is one of the important challenges that we face in the pediatric community, in addition to all of the work that everyone is doing to respond to the pandemic. So thank you, and thank you to the team in the Bureau. It's really just a pleasure to be here with you all today to focus on an initiative that really is about recognizing innovation and collaboration and service. As all of you know, today we're announcing the final winners of the Promoting Pediatric Primary Prevention Challenge, which thankfully we call P4 for short. You all know that we established this challenge to respond to the issues that are facing communities as they work to keep our children safe and healthy during the pandemic. We all saw throughout the pandemic that pediatric primary care visits and routine immunizations have declined, leaving our children and youth vulnerable to a variety of health risks beyond COVID. As many of you know, rates for routine vaccination for childhood diseases like measles dropped by as much as 60% at one point during the pandemic. And children from African American and Latino households miss these appointments, unfortunately, more frequently than children from other households, which has exacerbated existing health disparities. And we know the variety of underlying social determinants that impact those numbers. Given our mission to improve health and promote access and quality services for all and to ensure health equity, we recognize the urgent need to reverse these declines. And that's why the Maternal and Child Health Bureau designed this important challenge. And this challenge is a unique thing for us. It's not our typical grant process. It really is a creative way that allows us to respond rapidly to emerging needs and to really tap into expertise and innovation across the country in a very quick way. And at no time is that more important than now during this pandemic and the challenges we have seen. And so the goal for the P4 Challenge was to create new approaches that connect families to well child visits and immunizations through primary care. And I'm really just excited about the volume of input that we got, the number of nominations, the number of projects that this initiative spurred, and the types of initiatives that we have seen that are very cross-cutting and reach all geographies and really have some very exciting initiatives. So, we've seen everything from work from health centers to children's hospitals, and really an effort to reach in and try to help families get the right information to make informed choices when they most need them. Obviously, there are a host of terrific proposals and a terrific action set the challenge will recognize, but I just wanted to focus on a few. There's a team in Texas that we'll talk about today who really use data to create specific risk profiles to be able to identify children in need of services by focusing on uninsured or where clinics had recently closed. And the team was then able to bring their mobile clinics right to children and families' doorsteps, delivering vaccines and enrolling children in medical homes to ensure that they receive coordinated care. We always talk about sort of meeting people where they are, and this is an example of how that's actually happening and spurred by this creative community here on the line today. A project in Colorado really providing holistic and timely services to increase access to care by overcoming some of what are, our traditional silos between different types of care. And so they were able to coordinate joint dental and medical clinics to reach children to receive all the care they needed in a more convenient setting for families. Again, really, really taking to heart that message of meeting families where they are, and really thinking about how do we reduce the burden on access to care and services, and thinking about coordinated services makes a ton of sense in that regard. And so a really good example of that. So these are exciting initiatives, and really the types of things that make an impact in communities and make a real impact for families. And so I'm just really delighted to be part of a team in my new role at HRSA, to stand alongside and work alongside a creative team like the team in the Maternal and Child Health Bureau that helped spark this initiative, and all of you on the line who have come up with really terrific ways to tackle what we all know is a challenge, and what we all will continue to sort of lean in and put all of our efforts towards addressing. So thank you all for the work, and thank you for your initiative, and congratulations to all of our final winners. And with that, I'll turn the webinar back to Dr. Warren for the next steps.
Thank you so much, Carole. We are so glad that you're here at HRSA, and particularly glad you could join us for this exciting announcement regarding the challenge. Here in the Maternal and Child Health Bureau, our mission is to improve the health and well-being of America's mothers, children, and families. And we envision an America where all mothers, children, and families are thriving and reach their full potential. As you heard from Carole, our challenge does just that. By addressing these concerns that arose during the pandemic, the hope was that we would encourage a wide range of partnerships to be able to develop new and effective ways to increase well-child visits and immunizations, because we know that the declines in these two measures really put the health of the children in our country at risk. So I'll start by giving you just a little bit of background about the P4 challenge. We designed the challenge to work over 2 phases with a total prize purse of $1 million. For phase 1, we asked applicants to submit a brief proposal outlining their solution. How would they address well-child visits, immunizations, or both? What population would they target? What data would they collect? And how would they build their team? This notion of partnership was incredibly important as we were looking to take these challenge applications. Typically, we get about 70 applications for challenges that we've run in the past. We received an unprecedented response for this particular challenge, 241 applications, more than 3 times the number that we normally received. We were also excited that those applications represented 44 states, 193 cities, and Puerto Rico. So a great diversity of applicants from across the country. Once we had all those applicants, our judges and expert advisors went to work. There was a panel of federal judges that were assigned. They selected 50 of the 241 applications to move on to phase 2. Those 50 applicants represented 23 states, and each of those received an initial prize of $10,000 to be able to advance the proposal that they submitted in phase 1. The proposals were to be carried out in a variety of settings, so everything from community health centers to academic medical clinics to mobile units. And importantly, they represented community partnerships. This was by design. So part of this was that we wanted our applicants to engage community partners on this particular topic. But our secondary goal of this is that now that those partnerships are in place, you will have additional partners in the community anytime there are emerging issues that impact MCH populations to be able to engage partnerships that are trusted and known to you, that you might be able to lean in on when emerging issues move forward. And so those 50 organizations implemented their proposals in phase 2. They had 6 months to do that. As you'll see on the next slide, we asked them to collect data on key pediatric health measures and determine how well those innovations addressed those measures. They tracked their performance on those measures for 6 months and then shared their progress with us. So we're pleased to say that with all of that hard work, all those collaborations and dedication, we've seen our nation's children get better care and more vaccinations. Since May 2021, when phase 2 began, P4 Challenge participants made it possible to deliver 22,942 immunizations and 52,177 well child visits to communities nationwide. The data provide us one way to evaluate success, but we also know that the challenge succeeded in building community relationships and inspiring creativity, wins that will benefit children, families, and communities well beyond this P4 challenge. The creative and powerful partnerships included those with Head Start programs, local food banks, ride-sharing apps, and others to connect families with resources that they needed to be able to engage primary care providers. One team's approach even made the most of a local high school football rivalry. They created a student competition to see which school would rack up more well child visits. In this game, every teen who visits their doctor wins. And that's true for every participant in the P4 challenge. While we are announcing the top 20 winners in phase 2 of this challenge, we're proud to salute each and every one of you who competed. You've made a significant contribution to improving children's health in your communities. After the challenge is completed, we will be sharing these winning projects with our partners across the country so that other communities and partners can benefit from your creativity. Before we get to the announcement of the winners, I want to thank the expert advisors whose guidance and insight helped MCHB to design, implement, and promote the challenge. You'll see on this slide Dr. Bill Adams, Dr. Katie Beckman, Susan Chacon, Jim Daniel, Dr. Kathy Edwards, Dr. Bruce Gellin, Dr. Kelly Good, Dr. Sharon Humiston, Dr. Mary Ann Jackson, Donna Mazik. On the next slide, John Reed, Dr. Pamela Rockwell, Dr. Elon Shapiro, Dr. Angela Shen, and Dr. Monique Turner. We appreciate these folks from being involved from the very beginning of the challenge. They helped us to take this kernel of an idea and mold it into a challenge. They helped us to think about how to engage applicants. And then throughout the process of the challenge, we're available to provide consultation and support as needed. We also want to recognize the federal judges who contributed their leadership and expertise in the design and implementation, and importantly, in the selection of the winners. Captain Greg Gorman, Dr. Tracy King, Dr. Suma Nair, Dr. Melinda Wharton, and Dr. Ellen Marie Whalen. We are grateful for all of them for getting us to this point in the process. So without further ado, it's my pleasure to announce the 20 final phase 2 winners of the P4 challenge. These are the winning teams who focused on a variety of topics, and we're going to start with teams who focused on increasing well child visits. Their innovative solutions to get to a wide range of children to be seen in primary care provider practices, including using mobile units and peer-to-peer social media campaigns. So congratulations to the Bronx Health Collective Infant Healthcare Maintenance Visit Project in Bronx, New York, increasing well visit rates among teens living in poverty, Fortify Children's Health that was implemented statewide in Virginia, the Well Child on Wheels, or WOW project, implemented by Pride Community Services Incorporated in Logan, West Virginia. Zipping Up Well Child Care, a mobile solution to equitable access, implemented by Peninsula Community Health Services Incorporated Head Start in Bremerton, Washington. And Bringing Children Back to the Office, the use of technology and child care programs to promote healthy children, implemented by Neighborhood Health in Alexandria, Virginia. On the next slide, we'll talk about teams who focused on increasing immunization rates. The innovative solutions here included using cutting-edge technologies such as artificial intelligence, data analytics, and mobile-based smartphone apps to reach families behind on their shots. Some teams offered incentives like diapers and free supplies to families who came in. So congratulations to these winners. Children's Health Immunization Locally Delivered Successfully, or CHILDS, implemented by the Child's Project in Manassas Park, Virginia. Clinical Connections, implemented by the Meharry Department of Pediatrics in Nashville, Tennessee. The design, development, and deployment of a mobile-based child vaccination program for underserved communities in Illinois using novel digital analytics, artificial intelligence constructs, and mobile-based engagement systems, implemented by the OSF healthcare system in Peoria, Illinois. Next, we'll talk about teams who focused on improving both well child visits and immunizations. Innovations included using telehealth, text messaging, and mobile unit services to reach kids of all ages. Some also include partnerships with dentists and eye doctors to ensure these specialists were encouraging visits and vaccinations. Congratulations to these winners. Well care and immunization novel solutions, improving immunizations and well care through school health roving vaccine clinics, and a primary care texting initiative. Implemented by Nationwide Children's Hospital team, Well Care and Immunization Novel Solutions, or WINS, in Columbus, Ohio. Promoting child health to children receiving foster care services, implemented by UT Health San Antonio, Wellness 360 Pediatrics in San Antonio, Texas. Checkup, child health engagement and coaching using patient-centered innovation, implemented by AllianceChicago in Chicago, Illinois. Northeast Valley Health Corporation Well Child and Vaccination Program, implemented by the Northeast Valley Health Corporation in San Fernando, California. Jefferson County Department of Health promoting pediatric primary prevention P4 challenge, implemented by the Jefferson County Department of Health in Birmingham, Alabama. Bundle Up Your Shots, early intervention and collaboration, implemented by Teen Pediatrics at Vista Community Clinic in Vista, California. University of Tennessee Le Bonheur Pediatric Specialist, Frazier Community Clinics, implemented by UT Le Bonheur Pediatric Specialists in Memphis, Tennessee. Partnering medicine and dentistry to increase vaccination and well child check rates in children ages 9 to 17, implemented by Denver Health in Denver, Colorado. The P4 Well Child Project, implemented by Erie Family Health Centers in Chicago, Illinois. Kids Care, a collaboration between Mid-America Regional Council Head Start and Swope Health Services, implemented by MARC Head Start and Swope Health Services in Greater Kansas City, Missouri. Carle Mobile Health Services, implemented by Kintegra Health in Gastonia, North Carolina. And improving well child visits, immunizations, and social determinants of health in pediatric patients impacted by COVID-19, implemented by Johns Hopkins Pediatric Primary Care Clinics in Baltimore, Maryland. Congratulations again to all 20 teams. And on behalf of all of us here at HRSA, we thank you for your dedication to children's health and well-being. We are so excited to see this great work continue in your communities. So now it is my pleasure, and I'm excited to present to you 3 of our teams who will tell you just a bit more about their projects. We wanted to give you a flavor of some of the winning applications that were submitted. So first, we will hear from Dr. Jessica Jack, a pediatrician from Denver Health, who will share about the partnering medicine and dentistry to increase vaccinations and well child checks in children ages 9 to 17. Dr. Jack, thanks so much for joining us.
Thank you so much for having me. So I'm really excited to share our project with you, which is titled Partnering Medicine and Dentistry to Increase Vaccination and Well Child Check Rates in Children ages 9 to 17. The team was composed of myself, a pediatrician, Scott Hamilton, who's a pediatric dentist, as well as Christine Krentz, a medical student, Aaron Buban, a 4th-year dental student, Mark Derniak, our data analyst, and Kojo Danso, who's also a pediatric dentist. Just for some background, dentists have been key players in preventative health for a long time. They counsel on things like healthy, low sugar diets, and they also routinely screen for and counsel on HPV. And what we've noticed is that children who are older than 9 often see their dentist more often than they see their primary care doctor. So this highlighted an opportunity to collaborate and to identify children when they're at the dentist who may be overdue for vaccinations and well child checks, and to address that gap in care. The aim of the project officially was to utilize medical dental integration to increase adolescent vaccinations and well child checks by 5%. Just some quick demographics, because I imagine that all of you are not familiar with Denver Health. We take care of a primarily Medicaid population, and we are a large federally qualified healthcare center. We consist of 11 community-based healthcare centers across the Denver metro area, 6 of which have dental clinics that are embedded within them. We had 3 pilot sites: Eastside, Westside, and Montbello. Eastside and Westside are somewhat similar in that they're a primarily urban, underserved population. And what makes them particularly similar for this project is that pediatrics and dentistry, while they're co-located in the same building, are separated by different floors, sometimes even up to 2 floors. We also piloted this at the Montbello Family Health Center, which is an urban, primarily Hispanic immigrant population. And in this clinic, medicine and dentistry are co-located on the same floor. Here's a kind of rundown of our intervention. So to address vaccines, we generated a report that was run every single day. And it identified patients who are overdue for Tdap, meningococcal, or HPV. And these are all patients who are established medical patients at Denver Health. The clerk would then, the day before the clinic, run this list. And when they were calling patients to remind them of their dental appointment, would also say, hey, you're due for your vaccinations as well. And your dentist is going to speak with you about that. When the patient came to the clinic the next day, the clerk would then place a large sticker in the chart that served as a visual reminder for the dental staff that this patient was overdue for vaccines. Additionally, we also had flyers placed all around the waiting rooms as well as the dental suites. So that way patients could see that their dentist and doctor were working together to address vaccines. The dentist would then address with the patient that they were overdue for vaccines. And if they agreed, the medical assistants from the co-located dental clinics would then come and vaccinate the patient, either in the chair during the dental visit, or sometimes if the medical clinic was having issues with staffing, they would send them upstairs to the medical clinic to register and get same-day vaccination. Patients who declined same-day vaccination, a list was then sent to the medical offices who would reach out saying that, hey, we realized that you were overdue for vaccines when you saw the dentist. Let's go and get you scheduled. And then we analyzed our data. Regarding well-child checks, it was a very similar process in that clerks notified the staff of them being overdue for well-child checks, and then the medical home reached out to schedule them. Looking at our data, this is for all of the clinics. We vaccinated a total of 2,438 patients in 2020. And due to this initiative, an additional 122 patients were vaccinated. This represented 3.8% of all the vaccines that were given at the pilot sites in 2021, but also was 5% of the increase seen compared to 2022. I have a run chart here. So first we'll look at all the clinics. And what you can see in the top graph is that we were kind of just like puttering along around 12%. We weren't making many improvements. And then we decided to assign a full-time dental champion to each clinic with weekly meetings. With a full-time dental champion, we saw a sharp increase, but then we had a lot of staffing shortages, as I'm sure a lot of healthcare centers across the country have. MA shortages, 45% of the dental staff turned over. And so we kind of puttered along and stayed around 12%. The Montbello clinic was a little bit different. So it averaged 19% overall. And from the end of August to the end of July to the end of August, actually was averaging close to 50% during that time. And then the dental clerk resigned. And if you recall, the receptionist or the clerk was the central part of the process, the one who let patients know that they were overdue, the one who put the sticker in the chart to alert the staff that they were overdue. And then our rates dropped off sharply. And then with retraining, we were starting to get back on track by the end of the challenge. Looking specifically at Montbello, an additional 343 patients received vaccinations. However, 51 of them were due to medical dental integration. The vaccines that were administered due to this project were 7% of all the adolescent vaccines that were given at the medical home and were a 14% increase compared to 2020. And then finally, looking at well-child checks, it ends up our dental clinics are very small compared to our medical clinics. So it was hard for them to make a really big impact. And we only saw a 1.2% increase in well-child checks secondary to this project. So as far as future directions and where we're heading with this, we learned a lot of lessons. I think the most important lesson that we learned is that dental providers can play a really important role in pediatric preventative disease, and that patients are not only willing to discuss vaccinations with their dentists, but they're oftentimes willing to receive vaccinations from their dentist. We also learned that having an integrated EMR for us that's epic between medical and dental is essential. That way the staff can feel confident that the vaccine information that they're receiving is accurate. And then things that were harder to learn were that in order to be successful, you need to have buy-in. So having leaders in each clinic who are taking charge is essential. And that understaffing really affected the ability of teams to adopt new interventions. As far as how we're planning to scale this, it's really best well suited for large federally qualified healthcare centers or other integrated health systems. And we hope that one day we can scale up to influenza, COVID vaccinations, and even think about extending up to adults, because I imagine that they also see their dentist more often than they see their doctor for things like tetanus, pneumococcal vaccination, as well as shingles. For sustainability, this project was really low cost. We spent $12 on stickers over the 6 months. And once the training is in place, it seems to go relatively smoothly. And you can see that once we've retrained staff, things were getting better again. And then where this project is heading, right now we're spreading this across our entire institution, to all 6 clinics that have dental clinics that are embedded within them. And we're also working with the Colorado Department of Public Health and the Colorado chapter of the American Academy of Pediatrics to change legislation to include dental staff as immunizing providers. We're so excited to have been a part of this project. And please, if you have any questions, feel free to reach out to our team. Thank you so much.
Thank you, Dr. Jack, and congratulations on that winning submission. I really love the example of how you all dived in to better understand how your patients were accessing care and recognizing that many of them were seeing dental providers as often, if not more often, than their primary care providers. And so using those opportunities to address those missed immunizations. Also want to call out what a wonderful example of an annotated run chart from a quality improvement standpoint. You all had fantastic data and data visualizations, and really appreciate you sharing those with us. So next, I would like to introduce Sandra Reese, who is a Head Start Health and Nutrition Manager from the Mid-America Regional Council, to share about the Kids Care Project. Sandra, welcome.
Thank you for this opportunity. My name is Sandra Reese Tinsley. I am the Health Manager at MARC Head Start. On the call with me, that's part of our team, is Dr. Kenneth Thomas, who's with Swope Health Services, Dr. Shelley Cooper, with Diversity Telehealth, and I believe Dr. Megan Crone, who is also with Swope Health Services, is part of this team. I'm going to tell you about Kids Care, the collaboration between Swope Health Services and MARC Head Start. James, will you move to the next slide, please? MARC Head Start is the grantee for early Head Start and Head Start programs in the greater Kansas City area, serving 2,400 children and families in Jackson, Clay, and Platte counties, Missouri. We have a network of 17 direct service providers. Swope Health Services, our medical partner, is a federally qualified center that has been providing comprehensive services, health and behavioral in the greater Kansas City for over 50 years. And Diversity Telehealth, our electronic scheduling partner, has provided telehealth services to underserved communities since 2014. Next slide, please. The partners have come together to address barriers, increase access, treatment, medical homes for children, early Head Start and Head Start children in their schools and in early learning centers. We've focused on primary prevention, intervention, and treatment, which included well child visits, screenings, oral health and treatment, behavioral health, and the integration of the Come On Now app platform, which you will hear about later on in this presentation. Next slide, please. Our target population, children, early Head Start and early Head Start children, ages birth to 5 who are uninsured, have no medical home, have not had a well child exam in the past year. Our 2 pilot sites at the beginning were a program in an urban core, Jackson County, and the program in Clay County, a rural program. Next slide, please. Collaboration. What we learned was that it's important for us to have regular and ongoing meetings to align processes, resources, and materials. It was important for us to mobilize, promote the Kids Care program to the Head Start programs, and to link these children and programs to the Kids Care program via the variety of services that could be provided through the mobile medical unit, Swope Health clinics, and the Emmanuel Clinic, which is a Head Start program. And expansion, the delivery of preventative health services to all who are part of the Head Start program. Next slide, please. Dr. Thomas will be speaking on sustainability and scalability for our initiative.
Hello, everybody. Can you hear me okay? Can you guys hear me?
Yes, we can.
Yes. Oh, good. Okay. Thank you. Thank you. Yeah, sustainability. I know we've all been there, and a lot of health centers have tried to put clinics in schools or in other centers, and often sustainability is the limiting factor. What we've tried to do is really incorporate sustainability into routine clinic operations. So our Kids Care program is our school-based program to provide services at schools and in the community. And Swope Health has taken it to basically provide the operational framework for the Kids Care program. Obviously, we will leverage our 330 grant. We have some local funding sources from, for instance, our city health levy. Obviously, Vaccine for Children program also supports the program. But really, we've developed a program to be sustainable through routine operations. That is billable encounters. Many children who are uninsured qualify for Medicaid, especially in the age of Medicaid expansion. If a child does not have insurance, we screen them for Medicaid eligibility. If they're eligible, we actively enroll them, assist the family through our Medicaid navigators to sign up for Medicaid. So we expect a more favorable payer mix to sustain for sustainability also. In terms of scalability, again, partnering with MARC on this. MARC is there to engage the family. So really we wanted this to be a MARC endeavor, not our endeavor, because MARC is there with the families. And we are expanding the program based on MARC's priorities. So again, we started with a rural site and an urban site, but since program implementation, we've added other MARC Head Start sites. Through these partnerships with MARC at these direct service providers, we're able to produce partnerships with those direct service providers. For instance, school district or early learning center. And through those partnerships, we're able to expand to the non-Head Start children at those sites also. At the school districts, we're able to start with Head Start and then expand to the elementary level and higher at those school districts. This partnership with MARC has really allowed us to create the model for expansion. So a couple years ago, when Sandra and I went down this road, they basically knew that there are guinea pigs, but we were able to create a model that now is pretty much plug and play. If a new organization comes to us for a partnership, or Sandra says, now we're ready for you to extend to another site, it's pretty much plug and play. We just plug that site into the program. So when it comes to scalability, this is going to be an active collaboration to expand throughout all of their sites and then into the non-Head Start sites also. Next slide.
Dr. Cooper.
Hi, I'm Dr. Shelley Cooper, and my organization, Diversity Telehealth, created the Come On Now patient engagement tool that uses HIPAA-compliant platforms to connect Head Start, Mid-America Regional Council, or MARC Head Start, Swope Health Services, and the early childhood locations in Kansas City and Excelsior Springs. So this provides a convenient way for clinics to invite families to schedule and accept appointments for early wellness visits. So the main objective of the collaboration between the three organizations is the scheduling and notification features that are designed to encourage parent engagement through two-way communication between families and providers. As I mentioned, patient engagement. It also has it notifies or notifications to multiple families simultaneously, allowing for age-appropriate healthcare information, Medicaid enrollment information, and authorization forms. And all of those are distributed through the Come On Now platform. We're especially happy to announce that it has a chat or text feature that allows families and health providers and/or staff to communicate with each other. So that capability to push out healthcare-related information to families and receive informed consent documents and other information is key to keep that patient engagement and communication lines open. So we attended health fairs and school open house events to introduce the Come On Now platform. It's available in the Google Play Store and the App Store. And as I mentioned, Diversity Telehealth is working with these two organizations on the P4 challenge. Next slide, please.
Our intervention impact. Since May 2021, we have provided 227 well child exams that have been completed. 131 were completed via a mobile medical unit, 70 at the Emmanuel Clinic, 26 at a fall health fair that Swope Health Services sponsored for MARC Head Start. Also during the fair, 6 children received eye clinic visits, and as a result, 10 children received follow-up care and glasses. Also, as a part of comprehensive services for Head Start, we incorporated oral health in our initiative, and 400 children have received dental exams. Next slide, please. This is a chart of the data that from our 2 sites, urban site and our rural site. And the Head Start sites that did not have the intervention are in blue, and the red are the 2 sites, that pilot sites. And as you can see, that there was a significant increase in the completion of well child exams and immunizations at our 2 pilot sites, anywhere from 10 to 11%. And I would just like to say, at our rural site, we just received board approval to move forward with a school-based clinic at our rural Head Start program. Next slide, please. Keys to success. Our keys to success are commitment to collaboration between partners, then the continuous communication between Swope Health Services, Diversity Telehealth, and it's just not only Dr. Thomas and Dr. Cooper, myself, it's our staff. It's Dr. Thomas's pediatric team, Dr. Crohn's dental team, and of course, my health coordinators and community health workers that are all part of making this project successful. Then standardized health forms for consistency to ensure families understand what forms that need to be completed, what and why. And then what we have learned over time is that families respond to services that are provided to them in a familiar place. And so that brings them consistency or the ability to know what to expect, because we have interventions and support staff to support them with understanding what services will be provided. Next slide, please. Outcomes. It has allowed us, meaning MARC Head Start, to think outside of the box to provide comprehensive services to children enrolled in Head Start. And that include increased health access for all, the establishment of medical and dental homes, the provision of well child care, including chronic health condition monitoring, immunizations. What's important is ongoing care, because that is important for our children, is that when they leave Head Start, they have a medical home where they can receive ongoing care. Continuity of care is realized, but most importantly, children are healthy and ready to learn. Thank you.
Thank you all so much. Congratulations. And what a wonderful example of partnerships with community organizations like Head Start, a great place to reach families with young children, and So appreciate the creative partnership and the work that you all have done to forge that ahead in the community. Thank you. Our third presentation today is going to come from Jennifer Morrison. She's a clinical research scientist from AllianceChicago, and she's going to tell us about the Checkup project. Jennifer, congratulations, and we're so glad you could join us.
Thank you. Good afternoon, and thank you for the introduction, Dr. Warren. My name is Jennifer Morrison. I'm a pediatric nurse practitioner at one of the community health centers in Chicago, and also a clinical research scientist at AllianceChicago. I'm delighted to be here today presenting on behalf of AllianceChicago. We are a health center controlled network that provides health information technology, research, innovation, quality improvement, and clinical collaboration infrastructure for over 50 community health centers across the country. And our project is entitled Checkup, or Child Health Engagement and Coaching using Patient-Centered Innovation. I'd like to take a moment to acknowledge our wonderful team for this project. We were very blessed to have a highly skilled group of individuals in different roles and with a variety of expertise collaborating on the project. In addition to this team, there were many individuals at AllianceChicago and our partnering organizations who offered their support and feedback throughout the project. So let's get down to it. We sought to reduce disparities in well-child visits and immunization rates through an innovative, bidirectional, and patient-centered communication platform that used artificial intelligence chatbots to accomplish 3 tasks. 1, to remind families of upcoming well-child visits and immunizations. 2, to engage families proactively with evidence-based anticipatory guidance materials prior to their visit. And 3, to facilitate easy appointment scheduling. We worked with a number of vital partners on the project. The communication platform that we used is the brainchild of ClickSoft, a patient engagement technology organization. For this project, we communicated with patients using Quincy, their chatbot with customizable smartphone-based algorithms for outreach. And Heartland Health Centers is one of our network health centers and a federally qualified health center here in Chicago with an incredibly passionate and enthusiastic staff. They were eager to pilot innovative approaches to improve patient care. And of course, we consider their patient families instrumental as one of our partners because they provided feedback to us throughout the project, and that was vital to the success of this innovative idea. A little more about the patient population at Heartland Health Centers. 82% of patients identify as racial and/or ethnic minorities. 99% of patients are at or below 200% of the federal poverty guideline. And for this intervention, we sent chatbots out to about 200 English and Spanish speaking families with children who were due for a well-child visit. Let's talk a little bit about our innovation. Quincy is a completely customizable chatbot. No app is required that can function on a mobile device or a computer. You'll see on the left side of the screen a mock-up of what one of our chatbots looked like. Quincy allows us to distribute handouts within the chatbot, which we used for the anticipatory guidance part of this project. It allowed us to ask patients questions and then respond based on their answers. For the purposes of this project, patient families received a regular text message on their phone, alerting them that their clinic, Heartland Health Centers, wanted to discuss their child's next well visit, and then providing them with a link to click on to enter into the secure communication platform. Once in the platform, patients could request that the health center reach out to them to schedule the appointment or specify that they would prefer to schedule the appointment themselves. We really tried to keep our chatbots fun, engaging, and personalized by mentioning a few developmental milestones that their child might be experiencing at that time. We utilized a learning health systems framework for this project. And so throughout our intervention, we collected feedback, not only from our partners at ClickSoft and Heartland Health Centers, but also from patients, allowing us to make continuous adjustments and improvements. We gathered the patient feedback through interviews and also by leveraging the chatbot technology itself, creating a patient survey chatbot that was sent out about 1 week after the initial chatbot outreach. Just to touch briefly on our results, you'll see 3 groups. Our dark blue control group consisted of about 250 patients with similar age ranges who were also due for a well visit during the project, but did not receive any outreach using the chatbot technology. Our intervention group in the middle is the group of 200 patient families that received the intervention text message linking to the secure chatbot platform. And then our intervention and engagement group, the light green group on the right, consists of the patient families that chose to open the link and engage with the clinic through the chatbot. Ultimately, when looking at our entire intervention and engagement group, ages 0 to 17, we saw a 13% absolute increase in well child visit and immunization completion rates compared to the control group. This group was 27% more likely to complete their visit. Equally important to us was understanding the patient experience with this innovative technology. Our user feedback chatbots were sent to the patients about a week after the initial outreach chatbot, and the results were overwhelmingly optimistic, with 88% of families noting a positive experience with the chatbot, 86% taking the time to review their anticipatory guidance handout prior to the visit, and 100% appreciating the appointment reminder. Oh, and we learned quite a few important lessons during this challenge. Chief among them was the importance of eliciting feedback from stakeholders, especially patients, and making adjustments to our approach to strengthen our intervention. In addition, we found that collaboration with our partners and colleagues resulted in new ideas and stronger work. From our patient and health center, we learned the following. Outreach should be patient-centered when possible, allowing patients options to communicate and schedule in a way that works for them, because every family's preferences and needs are different. Communication technology should be sustainable and scalable, able to customize and easily adaptable to various departments, workflows, and patient populations. We found that these solutions can enhance revenue and support value-based reimbursement by increasing visits and reducing no-show appointments. And in a stressful pandemic environment, health centers welcome approaches that will reduce staff burden. This platform minimizes time spent on individual reminder calls and engages patients in various ways prior to their visit to help streamline provider-patient interactions during their in-person visit. The communication platform offered options for easy scheduling, escalating to synchronous communication for triage or other concerns, and many other unique features. It was truly an all-in-one solution. We were really excited by the positive feedback and results from this project, and we look forward to exploring other opportunities to leverage this technology in the community health center population, especially to expand opportunities for interactive and personalized education. And so I'd like to take a moment to thank HRSA, the Maternal Child Health Bureau, and the P4 Challenge team for sponsoring such a wonderful challenge. The P4 Challenge allowed us to implement this innovative idea in one of our partner health centers. It pushed us to establish new partnerships and relationships with ClickSoft and Heartland Health Centers to collaborate internally with our partners and with you. We truly enjoyed the periodic check-in calls where we were able to hear all about the innovative projects and ideas from other challenge participants, and we learned quite a bit from all of your experiences as well. Finally, the P4 Challenge allowed us to pilot a unique service within the community, which will hopefully strengthen our knowledge of helpful communication strategies to improve engagement with families and pediatric care, especially in vulnerable populations. Thank you for this wonderful opportunity to present our project, and my contact information is there if you have any questions. Thank you.
Thank you so much, Jennifer, for that presentation. And what a wonderful example of harnessing the power of technology. And I really appreciate how you all also importantly assessed patient experience and really trying to understand how families utilized and their level of satisfaction with the project. So thank you so much for sharing that. Really want to thank again all of our applicants for all the engagement throughout the P4 Challenge. It's been such an exciting journey, and most importantly, we're grateful for the work that you have all done in your communities to increase well visits and immunizations and address disparities there. We hope that the community partnerships that you all have forged will be helpful as you move forward to address other issues in your community. With that, to close us out, I'd like to turn it over to Jamie Elliott with Capital Consulting Company.
Thank you, Dr. Warren. This concludes our webinar for today. A recording of today's webinar will be shared, and we thank you all for participating.